Blessings one and all. It is with great honor I stand here today among such a dedicated group of people. I want to express my gratitude to Grace Hill Bible University and the Victorious Living Foundation led by Dr. Nicole Francis Cotton. Dr. Francis Cotton is someone I deeply respect, not only for her hard work as a certified holistic health coach, but also for her unwavering commitment to improving lives. Guess what? VSR too is in the profession of improving lives. For this reason, we did not hesitate to collaborate with Victorious Living Foundation on this important initiative, in particular for this sensitive topic of suicide, that will be addressed from different perspectives. Suicide is a silent crisis that impacts individuals, families, entire communities. Suicide is on the rise in our community, with the most recent victim only 14 years old. As Minister of Public Health, Social Development and Labor, it is my responsibility to help break that stigma. We must understand what brings someone to such despair and work together to providing hope and support. By raising awareness and having open conversations, we can save lives. With regard to the participants in this masterclass, based on conversations and their professional backgrounds, I can state with confidence the knowledge and commitment in this room have the power to change lives and strengthen our community. Your efforts are building a future where no one has to face their struggles alone. Let us remember that suicide prevention is a shared responsibility. It is something we all can contribute to as family members, friends, and community members. Together, with God's guidance, we can create a network of love, support, and understanding. Thank you, and may God bless you all.
Today, I bid you all welcome while I share my presentation, which is titled Out and Inpatient Treatment of the Suicidal Patient. Allow me to introduce myself. I am Sashira Tomasia Hyman. Let's take a look at today's agenda. Outpatient treatment of the suicidal patient. Inpatient treatment of the suicidal patient. Differences of inpatient and outpatient treatment, outpatient psychotherapy, outpatient risk factors, making the decision to hospitalize, risk factors for inpatient suicide, inpatient environment, conclusion of inpatient and outpatient treatment for suicidal patients. Outpatient treatment of the suicidal patient. Outpatient treatment refers to a type of mental health care where patients receive therapy and support while living at home rather than being admitted to a hospital. This approach allows individuals to maintain their daily routines and responsibilities while still accessing professional help. Outpatient treatment can be effective for individuals who are stable enough to manage their symptoms at home, but still require ongoing support and intervention. Inpatient treatment of the suicidal patient involves providing care in a hospital or specialized facility where patients can receive intensive support and monitoring. It provides a structured environment with 24/7 supervision and support from medical professionals. Inpatient treatment is recommended for individuals who are at high risk of self-harm or suicide, as it allows for intensive monitoring and immediate intervention if necessary. Patients participate in therapy sessions, medication management, and group activities designed to promote recovery. Differences between inpatient and outpatient. In summary, the key differences lie in the setting, level of care, duration, intensity of treatment, indications for use. Keep in mind that inpatient care is more intensive and closely monitored, while outpatient care provides more flexibility and independence. Outpatient psychotherapy. Outpatient psychotherapy refers to therapeutic services provided to individuals who do not require hospitalization. Patients attend scheduled therapy sessions while living at home, allowing them to maintain their daily routine and responsibilities. Outpatient psychotherapy includes individual therapy, which is one-on-one sessions with a licensed therapist focusing on the patient's specific issues such as depression, anxiety, or trauma. Group therapy, sessions involving multiple participants who share similar experiences or challenges. Family therapy involves family members in the therapeutic process to address relational dynamics and improve communication within the family unit. Cognitive behavioral therapy, CBT, is a structured approach that helps individuals identify and change negative thoughts, patterns, and behaviors. Outpatient risk factors. Outpatient treatment for individuals at risk of suicide comes with various risk factors that need to be considered to ensure safety and effectiveness. Some of these risk factors include severity of symptoms. Patients with severe depression, anxiety, or other mental health disorders may have a higher risk of suicidal thoughts or behavior, making outpatient care potentially less safe without close monitoring. History of self-harm or suicide attempts. A history of previous suicide attempts or self-harming behaviors increase the risk during outpatient treatment, as these individuals may require more intensive support. Lack of support system. Individuals who do not have a strong support network of family or friends may struggle to cope with their feelings and may be at higher risk when treated on an outpatient basis. Substance abuse. Co-occurring substance abuse issues can complicate treatment and increase the risk of suicidal behavior, as substances can impair judgment and exacerbate mental health symptoms. Non-adherence to treatment. If a patient is not compliant with therapy or medication, their risk of worsening symptoms and potential suicidal ideation may increase. Recent life stressors. Significant life changes such as loss of a loved one, jobless, or relationship breakdowns can elevate the risk of outpatient settings. Making the decision to hospitalize. Making the decision to hospitalize a patient, especially one at risk for suicide, involves careful consideration of several factors. Here are some key points to consider: assessment of risk, previous history, co-occurring disorders, crisis situations, support system, treatment compliance, patient's insights. The final decision should involve collaboration with mental health professionals, the patient, and his or her support system to ensure the best outcome for the individual's safety and well-being. Risk factors for inpatient suicide. Risk factors for inpatient suicide are critical for ensuring patient safety in a hospital setting. Here are some key factors to consider. Previous suicide attempts. A history of past suicide attempts significantly increases the risk of future attempts, particularly in an inpatient setting. Mental health diagnosis. Certain diagnoses such as major depressive disorder, bipolar disorder, schizophrenia, and personality disorders are associated with higher suicide risk. Substance abuse. Co-occurring substance use disorders can elevate the risk, as substances can impair judgment and increase impulsivity. Recent life stressors. Experiencing significant stressors such as a loss of a loved one, relationship breakdown, or legal issues can contribute to heightened suicide risk during hospitalization. Lack of social support. Patients who feel isolated or lack a strong support system may be at greater risk for suicidal thoughts and behaviors. Impulsivity and aggression. Patients exhibiting impulsive behavior or aggression may pose a higher risk for self-harm or suicidal actions while inpatient. Inadequate coping skills. Individuals who struggle with effective coping mechanism may find it challenging to manage their emotions and stressors, increasing their risk. Medication non-adherence. Non-compliance with prescribed medications can lead to worsening symptoms and increased risk of suicide ideation. Understanding these risk factors is essential for healthcare providers to implement appropriate monitoring and interventions to prevent inpatient suicides. Inpatient environment. Psychiatric rooms and hospitals have several key design features created for patient safety. Some of these measures include no sharp objects in the room, walls with rounded corners, heavy or immovable furniture to prevent barricading or throwing, doors that swing outwards, tamper-resistant fixtures and breakaway shower rods, high ceilings, room placement away from entries and exits, no glass mirrors and televisions placed behind plexiglass, open floor plans for visibility. Conclusion: both inpatient and outpatient treatment for suicidal patients play crucial roles in providing comprehensive care. Inpatient treatment offers a structured environment with 24/7 monitoring, ensuring immediate safety for those at high risk. On the other hand, outpatient treatment allows patients to receive care while living at home, promoting independence and integration into their daily lives. Ultimately, the choice between inpatient and outpatient treatment depends on the individual's specific needs, risk factors, and support systems. A combination of both approaches may also be effective, providing a continuum of care that addresses the complexities of suicidal ideation and behavior. These are my references where I got my information for this presentation.
Thank you for taking the time to watch the previous enlightening presentation from Grace Hill Bible University, St. Martin Campus's Suicide Assessment and Prevention Masterclass, themed Igniting Hope in Our Community, Preventing Suicide. We are extremely grateful to the Honorable Minister of Public Health, Social Development and Labor, Mr. Richanel Brook, and his cabinet for agreeing to collaborate with us. This masterclass was presented by the students of the Master's Counseling Degree Program of Grace Hill Bible University, St. Martin Campus, both as a public service and as part of their grade for the course, Introduction to Suicide Prevention, Assessment, and Treatment. I am Dr. Ernie Mae Francis Cotton, the chair and developer of Grace Hill Bible University's Counseling Degree Program for the St. Martin Campus, in collaboration with Victorious Living Foundation, of which I am the visionary. Victorious Living provides personal and professional development tools to transform families, relationships, youth, individuals, and organizations through coaching, training, counseling, retreats, workshops, and conferences. Let me briefly share about Grace Hill Bible University so you understand the mission and vision of the university. Grace Hill Bible University equips men and women for Christian living and Christian service worldwide. Its vision is to bring glory to God and hope to the world by preparing students for Christian service. GHBU is accredited by Global Accreditation Association for Biblical Institutions, which is authorized by the state of New Jersey. The degrees and programs offered either meet or exceed the New Jersey status. The university was founded by its president, Dr. Aldanza Ambrose. The dean of the St. Martin campus is Dr. Orlando Wilson. So who am I? And why do I qualify to be able to develop and teach a master's level counseling degree program? Well, I co-developed the grief counseling course for the Bachelor of Science in Social Work for the University of the West Indies. I graduated with honors from the University of Tampa in 1995 with a BA in psychology. I earned a master's in counseling with emphasis in marriage and family therapy from the Oral Roberts University in 2000. I was awarded an honorary Doctor of Divinity by Grace Hill Bible University in 2006. I'm a certified success coach with the International Coaching Federation, a certified lifestyle prescription health coach, and emotional freedom techniques practitioner. I also obtained specialized certification in trauma therapy and have been successfully providing therapy and coaching locally and internationally for the past 25 years. In short, I am a master therapist who helps my clients to transform their lives. Several years ago, I was asked by the Dean of Grace Hill Bible University to teach a biblical psychology class. And while preparing to teach that class, I did some soul searching and admitted to myself, too many people in our societies are emotionally, psychologically, relationally, and spiritually challenged. As a result, our families and communities are experiencing dysfunctional and unhealthy relationships. I determined that if I am truly to help our students make an impact on our island and the world, they must be equipped to meet people where they hurt most and have the necessary skill set and mindset to transform their lives. Consequently, I set out to design and develop Grace Hill Bible University St. Martin Campus's counseling degree program. I'm delighted to share that we've had several pioneers who graduated from the program and are making a difference on St. Martin and in the world. Our classes are offered online through our virtual classroom. Therefore, anyone from around the world is able to access our courses. We provide the curious learner who has a passion to counsel the fundamentals of counseling to be able to address the growing needs and challenges in our societies. Courses include Christian counseling from an African indigenous perspective, utilizing energy psychology in counseling, effective counseling techniques for transforming the lives of children, young people, and families, which is being offered this semester. The fundamentals of marriage counseling, counseling ethics, suicide assessment, prevention and treatment, spouse abuse, a treatment program for couples, effective grief counseling, counseling practicum, counseling internship, and more. Last semester, our deep dive focus was suicide assessment, treatment, and prevention. Our island has experienced the tragic loss of precious souls over the past several months due to suicide, which has sent shock waves in our community. Our hearts go out to the families who have been directly affected by these deaths. It is therefore absolutely imperative that as a nation, we are aware of the signs that someone is contemplating suicide, and that we have the necessary tools to support and encourage them to find better solutions to their challenges. Therefore, this course serves such a need. Together, and I mean together, we can transform the health of our nation through education, and we can prevent suicide by igniting hope in the hopeless. Thank you for your attention, and together let's take care of ourselves and each other and transform our nation.